Hello, I'm JJ Hodshire, President and Chief Executive Officer of Hillsdale Hospital, and I'm excited to share with you some incredible news regarding Hillsdale Hospital and our national campaign to promote and encourage rural health across the country. Now, I want to take you through a very brief history. First, as many of you know who have been with us on this journey, during COVID, we were faced with unprecedented times. We didn't know what we didn't know. And so we, the hospital, first among any hospital in this nation, decided to take to social media on various platforms to share with our listeners, primarily targeting Hillsdale County, what was happening around COVID. Now, what was born out of that was really a national audience. Our Facebook posts were shared with tens of thousands of viewers across this country. We heard from individuals in states far from Michigan talking about what Hillsdale was doing to educate our community. And we felt that was very important. And so we started a campaign called Hillsdale Strong, because many hospitals were predicting that they were going to close or lose volume because of the surgeries being shut down and potentially shuttering their doors. And so what we wanted to do is to encourage our community that we are Hillsdale Strong collectively, coming together, supporting each other, supporting the services of the hospital, finding new ways to engage our providers, such as telemedicine, which really was birthed out of this for our community. And we found new ways to lead and new ways to serve our population. So we were Hillsdale Strong. Remember those yard signs that said Hillsdale Strong? I see actually some of them still as I travel the roads. They're years old. That is our commitment, and that was our pledge at the time. So we circle ahead and we get through the pandemic, and we have very little casualty. And that's because we had, as a hospital, hardened our infrastructure, took the precautions we needed to, and we sustained some of the most difficult times in healthcare. So we launched a campaign off of Hillsdale Strong, and then said, you know what, let's segue that. Let's keep Hillsdale Strong, because that's what we are, but let's identify Hillsdale as the first choice for our patients. And so it became Hillsdale Strong, Hillsdale First, that when we put Hillsdale first, we can all remain viable and strong. And that campaign has gone on for several years, been very successful. It has really encompassed who we are and what we have become. Then the one big beautiful bill in which we, the hospital, myself included, became spokespersons against the legislation because of the devastation that we knew it was going to have on the Medicaid population. And ultimately, in rural communities like Hillsdale, the Medicaid population, which is the majority of our book of business, and the impact that that would have on uncompensated care, individuals losing coverage who would have lack of care, and poor healthcare outcomes. We knew what that would result in. And so we became spokespersons for this initiative to say we need to be the voice of the patient. And we lobbied hard. We lobbied long. We lobbied in Congress. We lobbied in the state legislature. We had numerous conversations with our elected officials, and we engaged our public, and we engaged each of our staff members to be champions of healthcare and to raise their voice. And that always comes with risk, right? Individuals that disagree with that or don't believe in the mission of that, but we continued to forge ahead. And as a result of that, we've lifted our voices. We've let our voice be heard, and there's a lot more to be said. So understanding that there's a lot more to be said, the impact to Hillsdale Hospital will, by the end of this legislation, be devastating. It will result in millions of dollars of losses for our hospital annually, and it will have significant consequences on the health outcomes in our community. So we got together again, marketing department with Kirsten Newland, myself, and we really sat down and had a discussion about, all right, we have Hillsdale Strong, then it was Hillsdale Strong, Hillsdale First. What can we do on a global appeal beyond just Hillsdale? Because let me tell you, these are hospitals outside of Hillsdale. We're financially viable and strong right now. And to sustain that over time, we've talked about our growth strategy. We've talked about initiatives that we're going to launch to increase our volume, to bring new services here and look at niche services, and that's great. But a lot of hospitals can't see that right now. And we determined that the way to do that is to be, in fact, rural health strong. How do we become rural health strong? It's by advocating. When we advocate and lift our voice in Hillsdale, we're talking about hospitals and systems beyond the border of Hillsdale County. And collectively, when we lift our voice, we have a stronger approach to Congress. We have a stronger appeal to the payers. We have a stronger appeal to the community. And so I'm excited that Kirsten, our marketing manager, is going to be on next to share with you some important and exciting details about our next campaign. So as we transition out of Hillsdale Strong, Hillsdale First, now we are Rural Health Strong. And that strength of rural health care has to be what sustains us. Coming together, lifting our voices. As a community, we have done that. We've demonstrated in Hillsdale County what we can do when we support local health care, that we're viable and that we can remain independent. But then it has to go beyond that. We have to help our brothers and sisters around the country. And so for that reason, we are Rural Health Strong.
Hi, I'm Kirsten Newlon, Communications and Donor Development Manager at Hillsdale Hospital. We are so excited to introduce our rural health campaign to our audience. It's important on a local level so we can keep our community educated on how rural health is being impacted and how Hillsdale will be impacted. And it's also important on a state and national level as we seek to unite rural hospitals and equip communities to be advocates of rural health. I'd like to walk through a few things of what you can expect going forward from this campaign. First, we'll be publishing a series of photos that represent rural health. This will come from our own Hillsdale community, but we invite other hospitals and other residents of rural areas to submit their photos of what rural health means to them and areas of their lives that rural health is a part of. We are also going to be publishing bi-weekly reports and dashboards that report on some of the important impacts of the legislation, things like healthcare job losses, facility closures, provisions of the bill that are affecting residents outside of even what we've anticipated. We know this is coming and we want to keep you as up to date as possible on it and equip you to inform others. We're also going to continue to publish videos, op-eds, written articles, and we'll keep our hillsdalehospital.com/Medicaid dashboard up to date as well. All of that information will be available to you. Lastly, we'll be publishing stories and testimonials from every corner of healthcare about this legislation and about the value of rural health in our communities. This could come from healthcare workers, from patients, from rural residents and families. It could come from administrators and lawmakers and anyone who has seen the value and the impact of rural health and wants to be a voice for rural health care. We're really excited about this campaign. We invite you to participate in it, to stay engaged in it, and to stay tuned for future announcements. Thank you for listening, and as always, remember, Rural Health Strong. Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.